Hello everyone, hope you guys are having a good Thanksgiving break. So my presentation is on influenza and rhinovirus, and my name is Erica. So here are our study questions. Feel free to screenshot or copy paste. I should have the questions posted on directly under this video, so you guys can copy paste it, screenshot, but I'll continue on with the presentation. So what is the difference between influenza and rhinovirus? So influenza is caused by influenza viruses. It's a common viral infection which has a potential for severe risk, and it attacks the lungs, nose, and throat. It's commonly known as the flu, and again, it has a potential for being severe. And symptoms can include fever, chills, cough, congestion, runny nose, muscle or body aches, headaches, and fatigue. And in some extreme cases, vomiting and diarrhea, but these are more common in children. So rhinovirus is Greek for virus of the nose, and it causes a viral infection called the common cold, and it is the most common virus in humans. So the common cold is less severe than the flu. Symptoms may include runny nose, sore throat, sneezing, headache, cough, and muscle aches. This can sometimes lead to bronchiolitis, which is inflammation of the bronchioles, and pneumonia, especially in babies. It's usually a mild illness, so one thing I wanted to point out is that rhinovirus can only really be severe in babies, but for the flu, it could also be severe in children as well. So here's a helpful little graphic from the CDC that states the differences between the cold and the flu. One thing I wanted to point out is that the flu kind of spreads more around your body. The cold more or less stays in your nose and in your throat. You do get a fever with the flu, and you often get a headache with the flu. So yeah. So now I'll be going over the rhinovirus. So rhinoviruses are spread through droplets, aerosols, or fomites. Droplets are large wet particles. Aerosols are small airborne wet particles, so these ones float around in the air and remain for quite a while. Fomites are particles that can rest on surfaces. So coughing and sneezing spreads droplets. Aerosols are often spread through close contact with those who are infected, and fomites can be spread most often by touching them and then touching your eyes, nose, or mouth. So the effect of rhinovirus on sports performance, it's usually a mild disease, so little modification is needed. But the number one thing you should do is let your body be your guide. Obviously, if you're not feeling well, you don't want to exercise. If you're pushing your body too much, then your illness will persist for a longer time. So you do want to make sure to give your body adequate rest, but mild to moderate physical activity may help you feel better by temporarily relieving that congestion. So being outside, breathing that fresh air, maybe getting some sun can help you feel a little bit better, just temporarily though. But if you do exercise, you should reduce the intensity or length of your exercise, and definitely allow yourself for adequate rest, even more rest than you already are getting. Since you are sick, hydration is more important. And you especially should not exercise if you have a fever, because it can be dangerous if you elevate your body temperature even more than it already is. You could go into shock. So treating rhinovirus is most often over-the-counter medications such as anti-inflammatories and decongestants. These can include cough medicines and syrups, But I should point out that these treatments, such as like Dayquil, NyQuil, they don't actually treat the rhinovirus. They don't kill it. Your body does that for you because, again, the rhinovirus is pretty easy for humans to get over. But what you should do is drink plenty of water, get rest, and if need be, you can soothe your sore throat through lozenges or sprays. You can take decongestants such as nasal sprays or drops, and you can take pain relief as well. If you're giving pain relief to a child that is 6 months or younger, you should only give them acetaminophen. If they're older than 6 months, then you can give them acetaminophen or ibuprofen. And then adults can take anything like acetaminophen, ibuprofen, or aspirin. So preventing the rhinovirus, you can prevent it through good hand washing habits and avoiding close contact with those who are sick. You should cover your cough or sneeze to avoid spreading, and avoid touching your eyes, nose, and mouth if you have dirty hands. And you should stay home when you're sick to avoid spreading the disease further. So moving on to influenza. So the influenza is transmitted the exact same way as rhinovirus. They're spread through droplets, aerosols, or fomites. So again, coughing and sneezing, close contact with those who are infected, inhaling the droplets or touching them, and then touching your eyes, nose, or mouth. I like this graphic here to the right. It really shows you how far droplets can spread, and that little motion of the droplets, the little wind that's coming out of the guy's mouth. It really shows you how far that those droplets can travel. So it's good to be careful. So the effect on sports performance, the flu is a little bit more intense than rhinovirus, so it will take longer for you to feel well enough to exercise. It is a respiratory illness, so you should proceed with more caution, especially because this disease can present with muscle aches and fatigue. So if you exercise earlier than you feel well enough to do so, it could over fatigue you or give you even more muscle aches than you already have. You should not exercise if you have a fever. And if you want to return to exercise, you should first cut your intensity in half. And if you do still feel unwell, then you should take an extra rest day before attempting exercise again. Some things to watch out for is increases in congestion, coughing, pressure around your chest, shortness of breath, dizziness, or failure to maintain balance. So treating the flu, most people have mild illness and do not need medical treatment. However, if you are at an increased risk for complications, if you have asthma, diabetes, or heart disease, you can get prescribed an antiviral. The one I have pictured to the right is Tamiflu. And this will help actually fight the virus. It'll decrease how long you have the virus for, and it'll generally make it easier if you are at increased risk. But otherwise, you should take pretty much the same over-the-counter medications and precautions as rhinovirus. And the big three are hydration, plenty of rest, and if need be, pain relief or anti-inflammatories to bring down that fever. So the number one prevention for the flu is getting the flu vaccine. And even if you do get the flu, it'll end up being less intense and much shorter in duration. So you'll be able to return to your daily activities way sooner than you would have if you had gotten the flu and if you weren't vaccinated. But you should also avoid those who are sick, cover your cough and sneeze, avoid touching your eyes, nose, and mouth with dirty hands, and practice good hand washing habits. And generally try to stay healthy, especially during the flu season, but you should stay healthy year-round, but especially during the flu season, you should be a little bit more careful. You should try to make sure your immune system is prepped by making sure you get enough rest, make sure you're drinking enough water, So if you do get sick, your body has those defenses on the ready. So I wanted to go over a little bit of myth debunking. These are myths that I've heard of. Some of them I haven't. Some of them I've looked up. But one of the biggest ones I've heard is to take vitamin C, and like people telling you that vitamin C will help fight your illness. Vitamin C boosts your immune system. I'm not sure what the second one is, and I guess people say zinc as well. But no research actually states that any of these boosts immune health, though I did find a source that said that vitamin C decreases the length by 10%, which is, I mean, a little bit different, but otherwise it doesn't really change too much. Another myth is that over-the-counter cold and cough medicines will cure your cold. Nothing will actually cure your cold other than your body actually getting adequate rest, because your body will fight it off for you, but nothing will actually cure it. It can help you bring down your fever and make you more comfortable, but it doesn't cure again. Another myth I've heard, my mom's told me, is wear a jacket or you'll catch a cold. So being cold doesn't give you the cold. Colds can only be spread through droplets of an infected person. Another myth is to take antibiotics. Again, the cold and the flu are caused by viruses, so antibiotics attack bacteria, so it won't do any help. This is something I've been told by an aunt is don't drink milk, it's bad for your throat. Milk does cause more phlegm, but it isn't actually harmful to you. If you do want to avoid milk just so you don't get phlegm, then power to you, but it doesn't actually hurt your body in any way. Another myth is that the flu vaccine causes you to get the flu. This is a myth because the virus is dead, so you cannot get sick from the flu. You may feel a little bit sore or a mild fever, but you won't actually feel as sick as you would be if you got the flu. So yeah, that's the end of my presentation. Hope you guys were able to answer the review questions, and good luck with the rest of your presentations.